I have started live. I just want somebody to check it. I'm waiting for Hamad confirmation.
I think the tech team has checked. We are live. I think we can start.
Okay,
Okay.
fine.
Hi, everyone. It is my great pleasure to welcome you all to this panel discussion on Let's Talk Experiences from the Field. Today, we have gathered a group of state coordinators of the ministry who have worked extensively on the field regarding drug use institutions, beneficiaries, and traveled months long to tribal areas, monitoring and evaluating the situations and progress of the welfare measures on the ground. So they will share their insights and we shall engage in a very stimulating conversation on this very important subject. I am honored to serve as your moderator alongside Ishwin for this session.
Thank you, Astha. Drug use has definitely become an important topic of discussion for today's time and age. And the purpose of this panel discussion is to foster a meaningful exchange of ideas, perspectives, and experiences that will not only enhance our understanding but also inspire actionable solutions to the challenge we face. The state coordinators of the Project Monitoring Unit have had extensive experience in the tribal areas of India, and their insights bring us valuable narratives, solutions, and observations. Now, with much ado, I would like to introduce to you all our participants. The first in line, we have Ariba Khalid. She's the state coordinator of Assam, Meghalaya, and Arunachal Pradesh. Then we have Medha Verma. She's the state coordinator of West Bengal and Sikkim. Then we have Ananya Majumdar, senior state coordinator of Assam, Meghalaya, and Arunachal Pradesh. Adarsh Tripathi, senior state coordinator of Karnataka. Nandini Rawat, state coordinator of Jammu Kashmir, Himachal Pradesh, and Ladakh. Priyank Das, senior state coordinator of Rajasthan. And lastly, we have senior state coordinator of Odisha, Mridul Jain. So the first I would like to call upon Ariba Khalid, and I would like to ask you what all states have you visited and what has been your experience so far? Ariba, I think you're on mute.
Hi, everyone. I have visited Arunachal Pradesh and Meghalaya extensively for this program, Nasha Mukt Bharat Abhiyan for Tribal Empowerment. And what I have seen is that because of them being border districts, being close to Myanmar, there is a huge problem of drug use amongst youth and women as well. Uh, Also, the districts, most of the districts in these two states do not have de-addiction centers. Like very few of them have it, and those ones are private ones. So a lot of people don't prefer to go to those institutions, and because of that, people are not able to get treatment. So they know that there is a problem because of Nasha Mukt Bharat Abhiyan, there has been awareness and destigmatization. However, they don't know where to go to seek treatment. So I think that is the biggest challenge that I have encountered.
So, Ariba, how do you think we can cater to this issue? It, in what opinion can be done to address the issue of lack of addiction and treatment facilities in these areas?
So, one of the most obvious answers is the Ministry funded de-addiction centers, the DDACs. I think because now they have combined all the three elements, CPLI, ODIC, and IRCA. So those will serve as a comprehensive place where you can get treatment also, and outreach activities and awareness and PPD treatment as well. I think that is one of the most important solutions for this.
Exactly, Ariba. Also, do you think how can we partnerships and collaborations between tribal communities?
Uh, Ishwin, your voice is breaking. I couldn't hear that question. Can you please repeat? Is it just me or
I think Ishwin was trying to ask what kind of partnerships have been fostered between the government and the organizations that you have visited, and how have either of the parties tried to strengthen the connection more?
I think I think in Arunachal, what I have seen amongst the NGOs is that they focus on fostering communication and trust. So they have been doing it through regular meetings, sharing information, and creating platforms for dialogue. So this has been done by non-profits as well as the local government functionaries there. And they have also been involving tribal community leaders like headmen and other elders in the decision-making process. So their wisdom and cultural knowledge are invaluable, and they have been coming together to devise effective strategies.
Uh, Ariba, can you hear me now? I think that was very insightful. I think next in line we have Adarsh. Do we have him? I can't see him on the screen.
I think Adarsh won't be able to make it today.
Okay, so I think I'll ask this question to Medha. What would you also think that the partnership that we have fostered between the government and the organizations in the field have strengthened more?
Um, Hi, Yusmin. I think definitely it has strengthened the whole PMVA more. So I would actually cite example of Sikkim. So what they are doing in Sikkim is they are working with tribal opinion leaders and women communities and different SHG groups also. So because tribal population has this challenge of being remote, isolated also in some sense. So the Abhiyan is trying to reach them through their own leaders. Like they are trying to train people amongst the tribes, and they are the ones who are taking it forward with other people.
That's true, actually. And from coming from there to a place like Jammu and Kashmir, I think Nandini, it's a very important area to work on. So, how has been the situation in Jammu and Kashmir when it comes to the partnership between the government and the organizations?
Hi, Asa. I hope I'm audible. Audible. So, in Jammu and Kashmir, organizations and government really been working extremely hand in hand with each other. The problem that we face in J&K is that the number of organizations that are working there are very less. So it becomes a little challenging to reach out masses, like to reach out a large number of people because of we don't have that much of human resource. But I guess we are yet to identify more organizations that are not directly linked with the government, with the ministry, but we can identify these organizations that might be working in other fields. For example, women empowerment or child education. So we can also take the help from these organizations and help in strengthening the Abhiyan, I believe.
So, we still see a lack of organizations recognized by the government, or that there is still some sort of a gap between the communication, or has it been that they are thriving on their own really well?
Uh, there is a lack of number of organizations working there, and I cannot really surely say that there are some unidentified organizations. There might be a possibility. That is what I'm saying. There might be a possibility for that. So we can try and identify more organizations because there are certain laws by which some external organizations cannot work in that UT. So we have to identify organizations within the UT itself.
That makes sense. So we see that in this rapid world, we come across like multitude of complex issues, and which also demands a lot of attention from us, and definitely a lot of collective wisdom. So, Medha, from your field, what do you think has been like the successful prevention and intervention strategies, especially in the tribal areas, to combat this drug issue that we have?
As I was saying earlier also, so what the state of Sikkim is trying to do is focus on community and community-based organizations, and they are trying to engage NGOs as well. So, because there are a lot of conflict with the laws also when you come to Sikkim, there's a state law for drugs or anti-drug state law. So people are little apprehensive when it comes to engaging with the government for awareness programs. But that is what the gap they are trying to fill in, the gap in knowledge and the gap in whatever information the communities do not have. So the whole Abhiyan there is driven by community, and especially with the young tribal girls and boys who are trying to, you know, take the lead and trying to spread the message. So that's actually, I would say, one of the best practices the state of Sikkim has.
Thank you, Megha. That was very insightful. So now I would like to ask Ananya, do you also think we face a similar challenges in the states that you have visited? What has been your field experience in this area?
Hi, can everyone hear me? So, I think when we talk about challenges, I think terrain, things like that, everybody knows about that already. We know that these areas are remote. We know that they're a little difficult to reach by road, by air, by train, whatever. Now, going beyond that, I think one of the first things we need to address is that when we talk about a tribal population, we're not talking about some homogeneous ethnicity. We're not talking about, X and Y, Z tribe, right? We're talking about different tribes in the same district, even in the same village also. So we are talking about different faiths, different belief systems, different um, practices in even in the same district, right? So it's when we are talking about challenges, obviously I think this is one of the largest things that we are seeing a lot of, like, large level policies go down, and we're finding it difficult to implement on ground because we don't know maybe the cultural practices of the people there. So for example, recently when we went to Hawaii and Arunachal Pradesh, the headman there was talking about how poppy cultivation there is actually a cultural practice. It's been in place for many years, and it's something which the locals are quite sensitive about. So like before the Abhiyan, that was the case. And even the superintendent of police, the SP, he was talking about how before, these type of topics were not discussed at all, and poppy cultivation was just something they did not touch because they knew the locals were very sensitive about it. But they, like once they started raising awareness from the DC office and from all the other stakeholders, the Mahila Samiti, and all these other groups, they started raising awareness. That's when they started actually being able to even have conversations that, and overcoming that challenge, that specific challenge in that way. So I think what Ariba earlier touched upon, which is that we really have to work with the leaders and the important people in those areas to actually make any sort of difference and to overcome any particular challenges in those areas. And obviously another one is the just stop me if I'm taking up too much time. Um, if one of the other ones is just just the lack of access to any facilities. So when I went to Dibrugarh in Assam, I noticed that a lot of the people there were actually not from Assam but from Arunachal. So they come down all that distance, driving like hundreds of kilometers if they have a car. Otherwise, just hitching rides, and they come all that distance just to like put themselves in a facility. And I'm imagining those are the people whose families were very motivated and very dedicated and very instant that they get treatment. However, for others who may not have that support system, we're seeing that they're not being able to access these facilities. So I think it should be a priority for the local administrations as well as for the state governments to reach into these areas and either build like their own state funded facilities, or at least some form of free facility is very much required. So
That's actually quite an interesting thing, you know, the situation of the cultural practices and what we are trying to do on the field. And I'm sure a lot of us have experienced that, especially regarding drug use, because a lot of practices that are culturally very acceptable are just, you know, the narrative around is just not the same. So what about the other PMUs? Have you also come across, like we don't need an answer whether you have provided a solution or not, but then have you come across some sort of like dilemmas like that where it's a cultural practice, but again, the kind of narrative we are trying to set up is kind of opposite to that?
I think Asta, I'll talk about my experience on field. I think I've also traveled extensively in Rajasthan, and I think one of the issues that came across there is that the tribal population is very sparsely located. Like in the northeastern, we see them together in one villages. Like there is a community. The presence of the community is one in one area. But I think that is a challenge in the state of Rajasthan that we have seen, that because of the one obviously because of the culture, the kind of climate it has, the population is very sparsely located, and it becomes a challenge for the administration also to identify and help out the people, reach out to them, create awareness in those areas. I think that has been one challenge when we come to Rajasthan. And I think that this could be a problem in when it comes to Ladakh or Jammu and Kashmir also. Do you think, Nandini, is it same for you all as
Yes,
well?
that could be a problem because these tribes, especially the Gujjar tribes, they are nomadic tribes. So they travel along the entire belt, starting from J&K, Ladakh, all the way to Himachal and sometimes towards Uttarakhand as well. So during winter season, they'll travel to the plains on or the areas downhills, and then during summer seasons, again they will go uphills to far-fetched areas. So it is very difficult to get hold on to these people or to mark their locations and then reach out to them accordingly. Yes, thank you.
Yeah, right. I think, yeah.
Yeah. I think, yeah, location and even reaching out to them has been one of the important topic of discussion when it comes to our job role. And along with all the situations that we face, we also do strive to, you know, provide like action and change on the field as well. So as we navigate through these complexities, it is also important that we move beyond just the discussions and explore practical solutions. My colleague Priyank, if you can let us know how can we improve the access to these quality addiction treatment services and resources for individuals, especially in these very remote tribal areas.
Hi everyone. Am I audible perfectly? Yeah. So thank you so much for having me on this panel. And yeah, so when we talk about tribal population, usually we find that in India, they are located either very sparsely, as Ashwin told, and either in very remote areas like in the northeast. I've been traveling to Mizoram and I have seen places where there are no roads, and still there are villages. There are people having their whole lives over there. So, so when we talk about the solutions that we might come up, so even if in Mizoram there are no roads at some places, but they have the internet connectivity. So the government of India has come up with this amazing project called E-Sanjeevani Mission, in which they provide telemedicine and teletherapy services to the patients that need them. So, if we help the tribal population and if we create awareness in the tribal population about the e-Sanjeevani uh, like platform through which they can avail their services of telemedicine, and they can get expert advice on how uh, they can work upon their addiction. So I think that will be a probable solution. Moreover, we can start capacity building of the village authorities, because the village authorities are a little more, I think, little more aware about the happenings of the villages, and they know a little bit about uh, how to reach out to the district officials. So I think capacity building is something we can focus on, and uh, the outreach and awareness campaigns that we have been taking going through in MBA is also a wonderful step that has been put in place prior also. And for long-term support and aftercare, I think we should uh, help the district administration with the uh, kind of training that they need, and also we should help them to reach these areas in like in far off places. So that will be something I believe which will be very helpful.
Yeah, I think you're absolutely right when it comes to the advocacy, right? Creating awareness, and Nashamuk Bharat Abhiyan, the foremost insight into the program is to create awareness. Ariba, do you think, so what do you think, how can we improve the quality access to these areas?
Technically, Priyank has already talked about, he has talked about telemedicine. Apart from that, there can also be mobile treatment services that bring addiction treatment resources directly to the remote areas. So even in the cases of DDACs, like I went to Upper Siang district in Arunachal Pradesh, its headquarters is in Yingkiong. Other blocks of the district, they're very far away from Yingkiong, and it won't be possible for the patients of other blocks to travel to Yingkiong and stay there at the de-addiction center, because it is very far and the road conditions are very bad. So I think, having mobile clinics or vans that has staff healthcare professionals who can provide assessments, counseling, or medications. I think these services will bridge the gap between remote communities and treatment facilities. Apart from that, I think it is also very important to invest in training programs for healthcare providers and community members in remote tribal areas, uh, build their capacity to address addiction treatment. Uh, because what I have seen in the districts is that they don't have trained professionals. They have social workers who have worked on other issues, but they don't know anything about addiction and how to deal with these things. Or counselors who have like studied counseling, but they are not specialized in this. So I think if we involve like training in evidence-based practices, trauma-informed care, and culturally sensitive approaches, it will help bring sustained access to quality treatment for the people in the remote areas.
think I think Ariba, that's a very innovative way of dealing with the whole situation. I'd like to ask Mridul, do you also think that so in what opinion do you how do you see this situation, and how do you think we can improve the access of quality addiction treatment facilities in these areas?
Right. Thank you, Ashwin. So I'd like to relate this with an experience of my field visit to Odisha. Odisha is also a predominantly tribal state, and from what I've experienced, tadi, it's a local alcohol which is very prevalent, and it's almost made in entire each house of the village. So being culturally sensitive and uh, differentiating a local practice and from hard drug substance abuse, that is something which we need to understand the difference and understand the different approaches which each of its treatment may take. So while tadi cannot be totally disjunctured from a community, because it's very ingrained in their culture for last so many hundreds of years. We can definitely push for awareness and greater sensitization amongst the community so that the youth do not progress to other hard drugs while once they are of and once they are adults and of once they are majors, like once they cross 18 years of age. And I also believe that we need to develop peer support networks which are strong and safe spaces in villages, in our communities, where people can address their issues, their concerns. Since these are so remote areas, and like Ariba and Priyank uh, have iterated, uh, there's a need of establishing mobile Medicare units, and they can play a great role in addressing the needs of these areas. I also believe that we need to engage in grooming up of local leaders who can engage in policy advocacy at their block levels, district levels, at the state levels, so as to reach out to the administrators and bring into their insights how unique the challenges these districts face, uh, and these districts, these areas need customized support and more resources to deal with the problems. So it brings to the last point that we need to focus on more collaborations, more partnerships with international NGOs, with local NGOs. We need to develop more local groups, and I believe this is one of the way forwards.
I think what Mridul is suggesting is that the issues that the tribal populations face are very local, and we need to have have different mechanisms for different situations and different areas. So, in what opinion Ananya, I would like to ask you this. And how do you think that the addiction treatment facilities and the access to these addiction treatment facilities can be improved?
Hello. So basically, my answer will not differ very much from what everyone has already said, which is that, we need to improve the capacities of the people who are already there. So, for example, if we just went to East Jaintia Hills in Meghalaya, and we saw this local NGO. They don't have any funding from any government sort of setup. They are sort of raising funds on their own, like through what we would call crowdfunding. And they're sustaining on that, and they have an OST center, like they have that, and they also work with FSWs, female sex workers, and they've got an entire program set up entirely in hotspot areas they've already identified. We've just onboarded them with the Nasha Mukt Bharat Abhiyan, and they're doing work for that already. And because they've already identified hotspots in which they are working, and this has become something that's very vital. We need to sort of what do you call leverage the pre-existing knowledge of the people who are at the lower levels. So that has definitely been something that we can do. As for the addiction treatment facilities, as for the DDACs, and that I think we need to work more closely with the district administrations. And because from their side, they are aware that the need exists. They know that they need these centers, and they are very much willing. But again, they're struggling with, as all of you have already mentioned, they're struggling with the resource persons who can actually handle these facilities. It's once they identify the building, and even that, in some areas, in some tribal areas, land is so very disputed that even to find a space to do something like this is very difficult. You in Shillong, for example, it's almost impossible to get an area. The government, the secretariat is on rented land, so it's very difficult for them to even get land to make these facilities. And I think Ariba was talking about Upper Siang, and they had to relocate. They were planning on relocating or something just to build an ETF or a DDAC, Ariba, something like that.
So I think that was a different district.
Oh yeah, sorry.
Mm.
Ariba, yeah, so they were like, they were planning on actually moving it to a building which was already, something was already going on there. So they had to, like they had to do a cost benefit analysis just to figure out which would be better. So I think the challenges are plenty, but working with the district administrations and helping them raise awareness among the populace that, we need these centers, and these are good people, they're good folks. They just need a little bit of help. They just need a little bit of treatment, and I think that'll go a long way in sort of increasing access in these spaces.
I think you very rightly said that we are in a need of a systemic approach where we set up a whole system from top to bottom, and we have those channels, how the information flow will be, how we'll be creating the resources right till the grassroots level. And as a ministry, as a department who's looking after, uh, who's fighting this whole issue of drugs, I think the another interesting part of our role here is that we see the unique set of challenges in the field, and that all of you have just mentioned that what kind of challenges we usually face when we're talking about the tribal population, when we are talking about the use of drugs, when we're talking about the local practices which are so accepted in the customs and everything. So now I would like to ask you, Medha, that what are the what are the unique challenges or barriers that exist in addressing drug addiction and providing treatment facilities in tribal areas? And what issues have you as a project monitoring unit faced when you are on field, when you're talking to people, when you are talking to like representatives from the government, when you're talking to the voluntary organizations? What are the barriers that you have faced in this area?
First challenge would be regular lack of regular funding to these organizations. So, as many of my colleagues have said, that number of organizations working in these areas already less. And when the funds are not regularly provided to them, be it state, be it central, run of whatever funds they are, whatever channels they have from. So, for them also, it's not easy to carry out work in such difficult areas. So the population which they're targeting is not easy to reach. It is not easy to convince also, because there are certain cultural practices and traditions which are attached, and an outsider cannot just go and question those practices and tell them not to, point that out that these practices are not right and you should stop doing it. So that there has to be a whole process of building a trust and trying to understand what uh, the people we want to work with are, what kind of opinions they have also, rather than forcing our narrative to them. And the challenge would be actually physically reaching these places. So as we were talking about the remoteness of these areas, and some of my colleagues said that mobile vans and everything can be used. In addition to that, we can also identify certain government machineries which are already working there. It can be primary health care centers or Anganwadi workers or ANMs. So you can work with them, which is also a long process of identifying those resources already existing there, and it will take a continuous effort from our side with the district administration as well. And other than that, uh, this is also a challenge that people know about these facilities, but they are centered in urban centers, and they actually are not equipped enough to come down to these places, because there in Northeast especially, there is like almost no public transport available. There are like shared taxis which are not running regularly, and some of them, if you take taxis also, they're very expensive. So if government has any intervention like identifying at the first level at the PHC centers, and then referring the people to these centers, and ensure that there's a last mile connectivity, ensuring there is a proper transportation for them to reach there. And in addition to that, another barrier I would see that if there are treatment seekers, sometimes there's a lack of follow up with them also. So when they are there out, then done with their treatment and they're doing well, they always fall back into that habit because they do not have anything else to look forward to. So proper skill training, proper engagement with them even after the treatment is over is very important.
I think what Medha is suggesting is that we need to have a better follow practice where we are, when once the person is outside a treatment facility, we are reaching out to them. We ensure that there are I think the drug use issue has one of the major issues that one of the most biggest challenge that we face is the cases of relapse are very high in this case. So I think the system of having a follow up and how to reach out to people, how to ensure that they are uh, away from the use of drug and they're not falling back into the whole trap. We need to ensure that. So another thing that Medha mentioned was that we need to ensure the connectivity has to be improved to the population where they are, how they reach to these institutions, how they approach these addiction facilities. I think that area needs to be more systemized and more solutions need to be put in place there. So I think Jammu and Kashmir and Ladakh is also one of the areas that can be challenging in this sphere. So can Nandini enlighten us about what are the challenges that she has faced on field? What are the barriers she thinks that are present in Jammu and Kashmir or Ladakh?
Aisha. So, I would like to first mention about Jammu and Kashmir. In Jammu and Kashmir, as I previously stated, we don't have many organizations working in this field. So we have a lack of human power. So that is one of the challenges. Apart from that, again, there is also a geographical isolation of certain places, as many of my other colleagues have mentioned. Areas are quite far-fetched, and it is very, and the connectivity in terms of transport is very limited. There are certain timings that it's a very limited connectivity. So from people, it takes a day or more for people to travel from one part of the district to just reach the district headquarters. So it is similar to around what Ariba previously mentioned and Punanya mentioned, that the connectivity is one of the issues, and the one Aditya previously mentioned, that there are lack of facilities in terms of organizations that are providing the addiction treatment facilities, whether the drug de-addiction centers that we talk about. That would be it.
That's absolutely correct. Like connectivity has been a huge issue, even when it comes to us, even when we need to reach those places to provide the resources given by the government. And going back to what Medha mentioned about creating that trust, as PMUs, how have you created that? Like, have you reached that space where the beneficiaries or people on the field really can look up to you, and how have you gone about it? Like, I think Mridul and Priyank can answer this question.
Right, Astha. So, creating trust is a long process, and it cannot be done in one or two visits. It needs a long time, regular engagement, and I would not say that I have been able to achieve that in my single or second visit. But over I have tried to be in touch with the NGOs which are working, because they directly work in the field and they are constantly engaged on the issue. So being on touch on phone with them, getting regular updates with them, and getting to understand what are the issues they are facing and how they can be resolved, that is one thing which I've tried to overcome this issue. And one thing which I've faced is this institutionalized set of idea of de-addiction. Like, you need to go to an institute, you need to stay there for 30 days, you need to stay away from your families. That often does not work in tribal areas, from what I have understood from not only tribal areas but generally, because families are a huge support system and are caregivers. And once we bring this idea into a community centered approach, where people are living where they're at their hometown or their villages only, and they are being provided care through mobile medical units or telemedicine, that might be a better alternate approach to go about to win their trust and to ensure that less relapse happens, and they are in continuous care for a longer period of time.
I think what can you guys hear me? Yeah. So I think what Mridul just said is very relevant, that the role of community in general has to be increased when we are talking about the people who are dealing with the issue of drug abuse, who are here. I think one of the, I would say, a very positive aspect of our integrated rehabilitation centers is that uh, there is a concept of having families and family counselings with the workplace. So I would just like to enlighten our audience that when an individual who is under the influence of drugs, who thinks he wants to get out of these, so when they seek and approach an integrated rehabilitation center that is run by Ministry of Social Justice, the the medications and everything is provided free of cost for people who belong to a certain section of society. And once they stay here, they stay in these de-addiction centers, they are free of they are what we call, they've cured out of the use of drugs. I think after that there's a concept of follow-up with the families. There is a process of rehabilitating them back into the community. I think that plays a very big role in streamlining and putting them back into the society, giving them giving them a dignified life. I think any of the panelists who would like to add on to that?
So, me and Asta visited East Sikkim district, I think last month. So we had a session with recovered people. So they were like 5 or 6 people who were sharing their experiences, how they went back to the community and how the Irka center they were taking treatment from. The founder of that center helped them actually go and connect back with their families. And they also cited it as an motivation to not fall back into the habit because they feel that difference. They feel that there was a man, so he was giving an example that now he's able to have a more meaningful relationship with his son. So, and he said that he won't give that away for anything. So he that pushes him, and so there are many such examples. Regular follow up does ensure that if there are still people looking out for you, even if you're out of that center, there are people still thinking about you. And if you need help, you might get it if you come back to these centers.
I think one of the most important part of our job role is to have the direct connection with the beneficiaries. And why do we need to do that? And that's what Medha has mentioned, that until and unless Medha and I actually went there and heard stories from the beneficiary directly, we wouldn't have felt as much as how as to what they were actually going through. And even the recovery, like most of us probably haven't even come across people who have been recovered or are in the follow-up process, but then to see that journey was just the next level. So as PNUs, I think these kind of debates and dilemmas do come to our minds because, we see these situations, and I think these have made us bring out better solutions to the ministry back. So I think our job role with of interacting with these beneficiaries is like extremely important in understanding these schemes, no matter how much money they're providing. Like it's a very important part of our role is to build that trust between people who are receiving resources and people providing. Also, Ananya, tell me about like your idea of like building the trust, and if there are any challenges you've faced. And challenges, like, again, doesn't have to be something where you have provided solutions, but like interesting ways of combating situations, like different kind of situations that people might usually not come across.
Okay. So I think one of the foremost examples that comes to mind is interacting with teenagers. They're terrifying, and sometimes in the PMU work, in the NMBA work, we've had to go to schools and colleges to speak to, to speak to students. And I think personally, I have felt it to be a bit of it's a bit of a barrier, like because their context is so very different from mine, and their childhood is so different from mine, and social media is playing such a huge role in the way these children's child like the way these their development journey as a whole is being impacted by social media and by all a lot of these platforms. And I feel like in a lot of senses, while in tribal communities we do have closer knit community, even that itself is there are loops and there are holes in that network. And I think one of the feelings that I have is that there needs to be more community centers and spaces for collaborative learning, rather than just schools where students go and they do the whole 9 to 3 and then go to tuition. I think there needs to be more spaces for collaborative learning, for after school programs, and spaces where children can actually occupy themselves rather than just leaving school and just roaming here and there, which is a lot, which is what happens in these areas because there's not really a lot to do, right? So where can we engage them, not in maybe studying, but in other ways, like in arts and crafts and all the other ways in which we can keep students occupied. So community centers, while are very I know the idea sounds really idealistic, but I think that they have a long way to go in keeping communities tied together. I hope that answered your question in a very
Yeah,
long-pointed way.
definitely. And I'll end this session today with the last question, and that's for Ananya because she is completing 2 years. So please let us know about the journey, especially when it comes to like the drug use institutions. Like, can you please
I think
summarize it?
I think there are a few other people on the call who are also completing 2 years, but
Oh,
thank you for
please,
the
please contribute to the question.
but thank you for pointing it out. So I think the experience has been very invaluable. I don't think there's been an unexciting travel plan that I've had. Like I've never not had a crisis come along, or never not had. um, Ariba can attest to that. She's been my faithful travel companion for the last year or so. So I think mostly when it comes to NMBA, when it comes to visiting de-addiction centers, and when it comes to visiting any centers which are funded by the government and interacting with the beneficiaries, I think, as you've already mentioned, like this has just been such a good learning experience. But because before I joined this job, I didn't even know what a Nashamukti Kendra was, let alone that there were so many in my city. So just knowing about these and being able to visit some of the like most far flung places in the country, being able to visit those areas and actually meeting and interacting with the districts, seeing the work that they do and how hard they work, and with the constraints and with their all of those things, has been a very good learning opportunity. And I think it's given me a lot of respect for the on ground work and for the in-field implementation of these schemes. So yeah, that's about it. Oh, and thank you to Ashwin and Asta and the team there for giving me the opportunity to be here today.
Thank you so much, Ananya. Mridul and Priyank, do you also want to share how your journey has been here? Priyank?
Uh, I have still lived with some months to complete 2 years now. But yeah, congratulations to Ananya. She has almost completed 2 years. So yeah, when I talk about my travel in Rajasthan, it has been comparatively more easier than what Ananya has experienced because she has been traveling to the northeast states primarily. Uh, but Rajasthan has its own challenges, definitely. But when I look at the people who are working on the ground, they are again very hardworking, as I said, and I think it's just a little support that they need from our side, which will motivate them and help them in providing better resources and better services to the society. And I believe and um, I believe that it's very important for us to give them these resources because they are a key part of schemes that we implement on ground because they are I think they are the most important stakeholders of these schemes. So and moreover, like I'm talking with experience, uh, like throughout the country, everyone who is working on ground is very important for us. So that's the yeah.
Thank you, Priyank. Mridul?
Yeah, thank you, Astha. If I may add, it has been really a humbling experience. Uh, like traveling to all those districts, places which I've never even heard their names, and going there, visiting, meeting people. It has been truly a really good journey, and it has given me a lot of great learnings. Uh, I have made a lot of good contacts on the field, people who have been working in the grassroots for almost all their life, and still there's a long way to go, but it has been a really good journey.
Thank you so much, Mridul. To end this discussion, I'll just highlight few solutions or few things that we've come up with all the questions. Is that we need to create more awareness when it comes to the resources that has to be distributed. We also need to skill local leaders and then develop local groups. We need to understand their needs and tailor the help that is needed. And we also need to work closely with the district administrators and also build the trust. And most importantly, put a lot of value in the follow-up process. So we've come to the end of today's discussion. And so the PMU's expertise and insights have been truly remarkable for both the beneficiaries and the ministry as well. So, and it will always greatly enrich our understanding on this subject matter. So I'd like to say that your dedication on the field will always make a lasting impact on the audience. So your contribution has not only made a difference to the event, but I'm sure it will inspire the people in attendance, including myself, so that even we can pursue further on this topic and research in this area. Ashwin?
I think once again, I want to express my sincere gratitude to all the panelists and attendees for being a part of this event. Together, let us embark on a journey of exploration, learning, and collaboration. I hope that this panel discussion will not only broaden our knowledge, but also ignite the spark of inspiration that will drive positive thoughts in our world. Wishing you all continued success in your endeavors. Thank you so much for attending the event today. Thank you to all the panelists.
Thank you.
Thank you.
Thank you
Thanks,
so much.
everyone.
Thank you, Rudy.